Thank you all for being here tonight. Students, you may sit down. Good evening and welcome to the Roseman University of Health Sciences College of Nursing ABSN Class of 2022 pinning ceremony. I am Dr. DeLoss Jones, Associate Dean of Faculty Affairs and Learning Innovation and Director for the Center for Innovation in Health Professions Education. I bring you warm greetings from Dr. Oxhorn, who is sorry he could not be here tonight. He did want me to tell those of you who are licensing in Nevada, your affidavits had been done. I have put the only message I have left from him this evening. What a great day. As educators, this day represents the outcome of us sharing our knowledge, skills, and attitudes. As families and loved ones, this day represents the fulfillment of the dreams and aspirations of those closest to you. As students, this day represents 696 clinical hours, 565 days, 19 assessments, 18 months, 15 blocks, countless sleepless nights, and probably a few tears along the way. This may also represent the end of a long and challenging journey. However, it is likely not the end. Through nurse residency programs, continuing education, or return to formal academic nursing education, such as the Roseman Family Nurse Practitioner Program, or our profession is all about lifelong learning. Healthcare is a dynamic world. New technologies and new discoveries and new patient interactions will continue to challenge the knowledge, skills, and attitudes that you have mastered over the past 18 months. Today, you are no longer student nurses. You are now graduate nurses. And over the next few months, one by one, you will begin to call yourselves registered nurses. I welcome you to our profession, and I am honored to have been a small part of your journey. Congratulations to all of you. You guys did very well on the comprehensive predictor as well. I'd like to invite to the stage now President Dr. Renee Kaufman, President of Roseman University of Health Sciences.
Good evening. On behalf of the Board of Trustees, the administration, faculty, and staff of Roseman University, I'd like to, first of all, welcome our nursing graduates, as well as all of the family and friends here today to help you celebrate. This is a great day, a very proud day. It's a proud day for me as the president of Roseman University because, as Dr. Jones said, we know what you all have been through. We know that the struggles that you've has taken you to this point. He talked about maybe a few tears that were shed. I hope there were a few laughs as well, because we pride ourselves on the quality program that we have at Roseman University, and you stand on the edge of one of the most important professions there is in healthcare, at the bedside every single day, caring for patients, and at no time probably in our history, our memorable history, have we been in such a situation coming out of a pandemic where the skills and knowledge and abilities of nurses have been more known and more appreciated. I'm really proud to say that I'll be happy to have any one of you take care of me anytime, although I hope you never have to. But let me be one of the first to congratulate you on this great achievement, and we look forward to hearing great things about you in the future. Thank you.
I am pleased to be able to welcome and introduce the Roseman University of Health Sciences College of Nursing faculty and staff. And bear with me, this is the first time I've done this on the podium. It's usually Dr. Oxhorn that does this. Hopefully I won't miss anybody. This group of individuals have dedicated their time and effort to provide these students with the education that they need to provide safe care in whatever clinical arena they find themselves. Please stand as I call your name. Denise House, Administrative Assistant to the Dean. Ms. Charlene Peitz, Admissions. Ana Guevara, she's one that put all of this together for you. And Miss Anya Reisert, also in our admissions department. On our cameras, we have Francia Garcia and Annie Ortega. And assisting us with our streaming tonight, we have Mr. Jason Gibson. And on this side, oh, we have Miss Christine Russell hiding over here in the corner. And on the other side, we have Dr. Barbara Tanner, Dr. Mary Faye Axon Armstrong, Professor Georgine Krieger, Professor Mel Obasi, Professor Augusta Arato, Professor Kylie Anders, Professor Jessica Morris, Professor Sheila Parker, Professor Stephanie Maston, Professor Nancy Bryan, Professor Asia James, Dr. Tamara Carley, and Dr. Fred Calixtro. And now we'd like to hear from one of you. We'll invite our student speaker up to the podium now, Miss Dahlia Liwanag.
Thank you for getting my last name right. It's pretty much butchered all the time. So graduates, parents, friends and family, and respected faculty administration, welcome to Roseman University's pinning ceremony. Good evening and congratulations to the class of Roseman University's School of Nursing graduates. I would like to first thank my fiance, Michael, for supporting me throughout this nursing school journey, as well as my friends and family who came out here tonight. I would also like to thank the class for giving me the opportunity to speak and electing me as your class president. It was a true honor to represent each and every one of you. Well, class, we finally did it. We survived 18 months of meeting the 90% minimum on all of our assignments. We excelled on the select all that apply threats to our degree. We battled our way against the almighty adult health too, because we know how much of a headache that was. We opened an extra tab for our ATIs just to let it run for 2 extra hours. During our clinical, we wrestled against the plastic PPE gowns, wore the most fashionable face shields, all while heroically wearing Las Vegas's most hottest scrubs in the county. A white scrub top and the baggiest maroon scrub pants ever. I'm so glad to say we finally made it. On my way here to prepare myself for tonight, I had to listen to one of the most inspiring artists of all time, the highly renowned and one of the most popular artists, Champagne Papi, where most of you might know him as Drake. I was blasting, started from the bottom, and I could not help but think back to the first day of orientation. We all went around the room to introduce ourselves, where I'm sure most of us were shocked to hear that one of the students had given birth the day before orientation. Also, to the students who gave birth right before orientation, during the program, and to the new dads, congratulations. Congratulations to all the parents in the program. I cannot imagine having to juggle nursing school and caring for your families because I can barely take care of myself and my dog. After orientation, I quickly realized we all signed our lives away. For the next 18 months, Roseman owned each and every one of us. On the second day of orientation, we were all divided into groups where the rest of the program would go to labs together, take assessments together, and we managed to not tear each other apart after working in group assignments. Then came our first clinical and left us with many new firsts throughout the nursing program, such as the first time we shouted at a nurse and trying to not get in the way of everything, the first time we changed out an adult diaper with a lovely surprise inside, the first time we bathed an adult other than ourselves, and the first time we comforted a crying patient. We also had our first time we stuck a needle in a person while trying to not hurt them, and the first time we took a test and received less than a 90% because we failed it, which was truly the bottom. The first time we delivered a beautiful and perfect tiny little human brought into this world, and the first time we saw a patient take their last breath. The first time we saw nurses perform CPR on a patient, for all of us to come home at the end of the day and to say for the first time that this is why we want to be a nurse. It is safe to say that we all started from the bottom, and now that we are finally here, we are graduating, and we, the class of 2022, finally made it. These experiences and life lessons have brought us together as a class as well as a profession. We learned that being a nurse is not just about getting good grades, but it is about loving ourselves and being who we are. No textbook will teach us how to care for a family whose loved one is dying, and we learned that no professor can teach us how to give dignity and respect for a patient while we change their diaper. We learned that nursing is just not about the medications and charting, but it is also about providing compassionate care to those most vulnerable. The challenges that we faced at Roseman not only led us to self-diagnose ourselves with stress overload related to sleep deprivation, social isolation, unbalanced nutrition, as evidenced by being a nursing student. These trials and tribulations gave us the confidence and courage and wisdom for all of us to be outstanding nurses. Now, I'm not sure if starting nursing school during the middle of a pandemic was the worst time or the best time to join this profession. And more than ever, our nurses leaving this career field because of burnout and stress. So as you guys prepare yourselves for the start of your careers as registered nurses, a clinical professor once told me, remember your why. Remember your why and why you chose this profession, and hold on to that why for 2 reasons. It will save you some time for the worst days on the job, and because it's a great interview question for job interviews. And now there are some people that I would like to thank. Thank you, professors, clinical instructors, and our class advisor, Professor Kreger. Thank you for teaching us life lessons and not just nursing material. Thank you for making this journey also incredibly difficult, Professor Arado, and not just because we now know that we can all work under stressful situations. Thank you for putting up with our attitude, especially after adult health too. Thank you for providing encouragement and words of wisdom throughout this journey. Thank you to our families and friends for your unconditional love and support. And lastly, thank you to my class for being you. Thank you for the laughs and entertainment, and of course, the study guides. Each and every one of you has a special place in my heart, and I know that you will all be kick-ass nurses. Congratulations.
Yes is always the correct answer, right? Check my mic, make sure everybody can hear me. Well, I think I can speak for everybody in this room and elsewhere. It's well-deserved. Great group, and I'm proud of you. And I think everybody else is too. Congratulations. So, the tradition of the pinning ceremony. In the 1860s, Florence Nightingale devoted herself to caring for casualties of the Crimean War. In recognition of her service, she was awarded the Cross of St. George. Florence then extended the honor by presenting a Medal of Excellence to most deserving student graduates of the Nightingale School of Nursing in London. Today, nursing schools around the world give a nursing pin to represent a Medal of Excellence to their student nurses upon graduation. The Roseman nursing pin is designed in the university colors of burgundy and silver. The shape of the pin symbolizes the unique block curriculum of the Roseman program. Each side of the pin represents the College of Nursing core values: service, integrity, innovation, and knowledge. The lamp of knowledge on the lower half of the pin signifies the nurse's science-based knowledge and commitment to lifelong learning, which are foundational principles of professional nursing practice. The lamp was a symbol of the care and devotion Florence Nightingale administered to the sick and injured in the practice of her nursing. After nurses were pinned, Miss Nightingale would light a lamp and pass the flame to each nurse as they said the pledge. Today we carry on the ceremonial tradition, passing of the light. And I want to correct myself, it was the Crimean War. Congratulations.
Are you ready to get started? This is the moment you've all been waiting for.
It is my honor to present the BSN students. So as you prepare to go upstairs, I will call your name. Okay, so let's begin. Brian Michael Alonso. Being pinned by Erminda Alonso. Yes, oh, sorry. It's my first time. Jessica Lisbeth Boyer. Being pinned by Sam Boyer. Sarah Amelia Cabral. Being pinned by Bridget Cabral. Megan Elizabeth Siriaco. Being pinned by Laurie Crispin. Tricia Maria Cooper. Being pinned by Christian Domingo. Nashan Melvie Davis. Being pinned by Dolores Crutchfield. Edward Sung Dong, being pinned by Josephine Dong. Oh, he wants to be called Eddie Dong. Sorry. Siri Geneva Duche, being pinned by Ryan Duche. Alison Perez Esguerra, being pinned by Luningning Esguerra. Angeline Libalib Feliciano, being pinned by Catherine Feliciano. Vanessa Gutierrez, being pinned by Maria Gonzalez. Jordan Mark Hill, being pinned by Esther Hill. Camilla Corazon Pama Ilanga, being pinned by Butch Pama. Wanda LaFay Lassiter, being pinned by Corey Lassiter. Michelle Lewis, being pinned by Richard Lewis. Actually, we spelled KK Lewis. Dahlia Abigail Liwanag, being pinned by Noel Buencamino. Hannah Nicole Lozano, being pinned by Josh King. Anthony Michael Malerba, being pinned by Brittany Malerba. Amber Nicole Mendoza Mapanao. Being pinned by Geraldine Mapanao. Pauline Wen, being pinned by Viet Pham. An Tan Wen, being pinned by Fu Hun. Crystal Anahi Para, being pinned by Anna Para. Teresa Giang Pham, being pinned by Stephanie Yang. Marian Ballesteros Kiba, being pinned by Bert Kiba. Kimisha Raymond, being pinned by Jocelyn Raymond. Andrea Romani, being pinned by Hector Romani. Ian Dominique Sacro, being pinned by Lily Sacro. Stephanie Emily Marie Swart, being pinned by Michael Swart. John Theodore Tolentino, being pinned by Dr. Dillis Jones. Megan Vo Tran, being pinned by Donna Tran. Elizabeth Ruth Vergara Gross, being pinned by Audie Vergara. Pamela Mercado Wilson, being pinned by George Wilson. Julie Macy Song, being pinned by Steve Mua. Congratulations, graduates of 2022.
Dr. Tanner.
Good evening, everyone. Superb. Congratulations to each and every one of you. I'm so very proud for all of your hard work and all of your efforts. Welcome to the profession. I'm going to be speaking the oath, and what I would like you to do is stand up. Okay. So while this is indeed a proud moment for all of us, graduates, you are here this evening to be recognized and congratulated. Your hard work and sacrifices have led to your successful completion of the BSN curriculum at Roseman Health Sciences. I would like to encourage all of you to continue lifelong learning, to stay current in your practice, and to adhere to professional standards of nursing practice at all times. That being said, would you please raise your right hand as we pledge the nursing oath together? As a co-advisor for Cessna, I'd like to give a little speech on Cessna because it's very important. Roseman University's Critical Care and Emergency Student Nurses Association, or Cessna, was founded to help students interested in the critical care and emergency nursing fields have a platform to learn about each of those specialties. The organization focuses on educating students through presentations from outside specialists in critical care fields, promoting nurse apprenticeship and internship opportunities in critical care areas, as well as doing volunteer work for the local community. During a disaster, the advanced triage system, which involves a color coding scheme, is often utilized. Red tags are used to label those who cannot survive without immediate treatment, but who have a chance of survival. Cessna chose the color red to honor this system, for each Cessna member is proudly wearing their red cords to symbolize their devotion to the critical care areas of nursing profession. Since its creation, former Cessna alumni have gained employment in emergency, ICU, NICU, and CCU settings. Our Cessna students have been very busy this past year with events that have included Stop the Bleed, blood donation drives, Valiant drives, Women's Center Drive, mechanical ventilation, CRNA speaker, ER, ICU, PICU, trauma, and triage speakers, the STAR RN program, as well as the flight nurse and travel nurse program. Cessna members, if you could please stand when I call your name. Brian Alonzo. Jessica Boyer. Sarah Cabral. Megan Siracco. Trisha Cooper. Angeline Feliciano. Camilla Lago. Wanda Lassiter. Rochelle Lewis. Dahlia Lawanag. Hannah Lozano. Pauline Nguyen. Teresa Pham. Kamisha Raymond. And Julie Zhang. Thank you. You may be seated.
All right. At this time, we would like to recognize the members of the Nursing Honor Society. Students are eligible for membership as long as they meet requirements on or before the designated due dates. Students will have demonstrated superior academic achievement, academic integrity, and professional leadership. The asterisk after a student's name in the program indicates that the student is a member of the Roseman Nursing Honor Society, as do the gold and purple honor cords that members wear at graduation. Honor Society members, please stand as I call your name and face the audience. Tricia Maria Cooper. Vanessa Gutierrez. Nashon Davis. Hannah Nicole Lozano. As a member of the Honor Society, a student must participate in community service and fundraising events. The group participated in community service such as the University Medical Trauma Outreach Program, Stop the Bleed, the Ronald McDonald's, Special Olympics, blood drives, munches for the militaries. In addition, the group participated in various fundraising events, such as the Pediatric Trauma Burn Conference Raffle, Bouquet and Lace. The funds that the students raise will help in completing the Advanced Cardiac Life Support, Pediatric Advanced Cardiac Life Support, and the Neonatal Resuscitation Program. The most current donation that the group actually gave was they've donated funds towards the Ukraine medical nurses to help the nurses and the medical members to provide care to Ukraine patients. So thank you for the donation, and for the entire month of March, the Honor Society is going to fund some money so we can send more to Ukraine. Thank you and have a good evening.
I've just been sitting here watching the great lamp migration across the group. Mr. Eric Dillon, our Director of Admissions and Advisors for the Roseman LGBTQ Student Association, could not be here this evening, but sends his congratulations and best wishes to all of you. The mission of the Roseman University of Health Sciences LGBTQ Student Association is to create a safe and supportive environment for university students identifying as LGBTQ and their allies, for the purpose of creating a sense of community, working to create a positive image for LGBTQ healthcare workers in the community, as well as to promote the overall health and wellness of LGBTQ students. As a member of the LGBTQ Student Association, members participate in various events that include the LGBT Lecture Series, fundraising efforts, Practice with Pride Initiative, the Blanket Drive, as well as annual Pride events within the Las Vegas community. We are very proud of these students for contributing to bringing awareness to these issues concerning the LGBTQ community, particularly in healthcare. At this time, we would like to recognize Megan Siriaco as an active LGBTQSA member. Megan, please stand. Thank you.
Aloha. I'm Dr. Mary Faye Axon Armstrong. I'm the faculty advisor for the Asian American Pacific Islander Nurse Association of Nevada, Roseman University Student Nurse Association. In short, APINA RUSNA. The first state student nurse association of the APINA Nevada, RUSNA, was officially formed in March 2019. The goal of APINA of Nevada is to unify APINA nurses in Nevada and beyond, to facilitate and promote networking and to develop collaborative partnerships between professional nurses, nurse researchers, nurse educators, advanced practice nurses, and nursing students and community affiliates with the sole purpose of identifying the healthcare needs of AAPIs and optimizing resources to promote healthy living and better their lives. APINA RUSNA students were involved in various community outreach for ethnic minority populations, specifically the Asian Pacific Islanders and other minoritized population. In the year 2020, as you can imagine, amid the COVID-19 global pandemic, the students participated in the free drive-up flu clinic and distributed over 1,000 frozen foods to families at the Las Vegas Chinatown Mall. Last year, 2021, APINA RUSNA partnered with the APINA of Nevada and Nevada State College and gave away blankets and lunch meals to the homeless population at Northern Las Vegas. Last May 2021, in the celebration of the annual Asian American Pacific Islander Heritage Awareness Month, Commissioner Justin Jones and the Clark County of Nevada commissioners recognized and honored and gave proclamation for the APINA Nevada and APINA RUSNA, that's us, for our contribution and participation in the Asian Community Development Council's pop-up vaccine clinic in Chinatown, Las Vegas, with a goal of vaccinating 1,000 people of all of the business owners and ACD's client population. The recognition and award included our Healthy Monday radio shows on PHLB Radio for increasing health awareness and vaccine confidence among the ethnic population. I also wanted to recognize Megan Siriaco and Dalia Liwanag for assisting in putting together a town hall meeting regarding the anti-Asian crimes. As you remember, there's a lot of Asians who died because of violence towards them. So on behalf of the members, it is our hope to instill passion and purpose to our nursing students and increase their cultural awareness. Everyone, please hold your applause after I call all the members so everyone may hear and acknowledge students. Students, please stand up as I call your name and face the audience so they can see your beautiful faces. Megan Elizabeth Siraco. Tricia Maria Cooper. Edward Song Dong. Alison Perez Esguerra. Rochelle K.K. Lewis. Ann Tan Nguyen. Marian Ballesteros Kiba. John Theodore Tolentino, Julie Macy Song. Please give the students your encouragement and support to persevere and serve our AAPI communities. Thank you and aloha. Congratulations, graduates of 2022.
All right. There are numerous stories regarding the tradition of the military coin. One such tale references a World War I pilot who was shot down and captured behind enemy lines. All of his personal belongings were confiscated except a small gold-plated coin bearing his squadron's insignia, which he kept hidden. Upon his escape from his captors, he came upon an Allied patrol. As he had no identification, the Allies assumed he was an enemy spy and ordered his execution. However, in the nick of time, he showed the Allies his coin and the insignia were recognized. So instead of shooting him, they gave him a bottle of wine. Following that tradition, pilots began to challenge members of their squadron to produce their coin. If you were not carrying it, you would be required to buy a drink of choice for the person making the challenge. Roseman College of Nursing acknowledges the achievement of our veteran students by presenting them with our challenge coin. The coin bears the American flag along with a lamp of knowledge and a glorious sunrise against the mountains like our nursing pin. The backside bears the bald eagle, which is a symbol of strength and determination and helps us to find the strength within ourselves to push forward and reach higher. I would like to invite Kamisha Raymond to the stage to receive her Roseman Challenge coin and remind her that unless she is buying the next round for everyone, she always keeps it close by. Thank you, Kamisha. Okay, how about a couple of awards? First award this evening is the Spirit of Nursing Award. The recipient of this award is a member of various associations at the school and in the community. The recipient volunteered at the Red Cross and Volunteers of Southern Nevada, attended various presentations by associations, and volunteered at the COVID vaccination clinics provided by the school. The recipient's experience as a caregiver started early, beginning at home, with this recipient helped care for a parent and then other members of the community. At the home, care was focused on the recipient's dad. The recipient provided meals, drove him to appointments, and took the time to provide a safe and caring environment while maintaining a commitment to attend and excel at school. The recipient helped a neighbor whose spouse had suffered a stroke and who was unable to continue to provide the needed care. Eventually, the spouse had to be transferred to a skilled nursing center. Both experiences reinforced the recipient's passion and commitment to nursing. During the recipient's clinical rotation, the recipient was assigned to the Children's Cardiothoracic Intensive Care Unit. While fulfilling that assignment, the recipient demonstrated compassion and was always willing to provide outstanding care both to the patients and to their families. The recipient observed family members spending time every day beside their child, hanging on with hope that their child would get better soon. The recipient noticed the family members would spend countless hours at the hospital just to be near their sick child. The recipient was consistently caring and compassionate to family members, taking time to talk to them and giving them updates regarding their child's condition. At the end of the rotation, the recipient was offered a position in the ICU. The recipient realized that working in the ICU as a new grad would be tough, but knew it was a path to becoming a strong, caring, and compassionate nurse. The recipient of the Spirit of Nursing Award is Miss Wanda Lassiter. And now the Dean's Award. The recipient of this award has participated in feeding homeless at shelters and has helped stuff backpacks with waters and meals for distribution to kids when they are not in school. The recipient has also volunteered to help clean parks when not doing schoolwork. During the recipient's clinical experience, the recipient cared for an older woman who was alone at the hospital and had no family members visiting her. The recipient made a point to acknowledge the patient while performing daily routines as part of the clinical rotation. Sometimes the recipient would simply wave or nod and smile at the patient while passing her room, and sometimes the recipient would pause and talk for a few moments, which made the patient happy, and she thanked her for her care. The recipient realized that taking just a little time to interact with a patient can provide hope and increase the patient's determination to get better. The experience helped solidify the recipient's passion for nursing, and the recipient looks forward to providing care for more patients at the beginning of a promising career. One professor commented that during the clinical rotation, the recipient demonstrated exceptional skill in both therapeutic communication and nursing interventions as an evolving nurse generalist. The recipient anticipated behavioral responses through attention to nonverbal as well as verbal presentations, both of which are essential for safety. The recipient also helped prevent behavior escalations while demonstrating care and concern during the clinical rotation. The recipient of the Dean's Award is Ms. Stephanie Swart. As we complete tonight's ceremony, I'd like to share a few parting words with the students, as this is probably the last time I'll ever have their attention. The first is, tonight you all took the nursing oath. I encourage you to take a copy of that and frame it, and remember to look back on it several times throughout your career to remind you what it is you promised to do and the care that you've promised to deliver to those around you. You're entering the world as a professional registered nurse. As you represent the future of our profession, I challenge you every day to ask yourselves, how should I be, not what should I do? I ask you to think about your character, your values, your virtues, your ability to act outstandingly. Your journey of discovery does not end here. Continue to ask yourself in each new challenging situation, how should I be? You've mastered the 5 rights of medication administration. Professor Krieger will say there's more. We'll stick with 5. I want to leave you with a new set of 5 rights. Always act at the right time, regarding the right thing, towards the right person, with the right intention, and in the right way. Be a role model for those you interact with and care for. And as you go forth, remember, watch your thoughts, they become words. Watch your words, they become actions. Watch your actions, they become habits. Watch your habits, they become character. And watch your character, for that becomes your destiny. This concludes our pinning ceremony. Thank you for being here and supporting your family and friends this evening. The students could not have completed this very challenging and rigorous program without your help. Your attendance has made this a memorable occasion for them. We're going to do a procession out, so if you would keep the middle aisle clear, we'll walk out. The students will come immediately back in and they'll be able to visit with you. Thank you so much for being here.